So I feel honored to have this opportunity to be here for this session today. So the topic would be glucose monitoring tools. So the firstly we'll go with the diabetes prevalence. As we all know that the world has got like 529 millions of people living with diabetes worldwide, and India has or around 77 million adults living with diabetes, and making it one of the highest in the world. So the prevalence is about 8 to 10% nationwide, but can exceed up to 15 to 20% in the urban areas due to lifestyle factors. And by 2045, this number is projected to rise to 134 million if current trends continues. So the ICMR India Diabetes Study is the largest survey on diabetes and other metabolic non-communicable disease undertaken in India. And a total of 113,043 individuals had participated in this study in between 2008 to 2020. And the overall weight prevalence of diabetes was 11 to 12%, and the diabetes and pre-diabetes was 15.3%. So what like how sugar fluctuates, how blood sugar fluctuates. So there are some factors that obviously affects blood glucose levels. So the dietary intake also affects the blood glucose levels, and the medication, if like if they have skipped medication or if there is less of inactivity, these are the factors that can increase sugar levels, so which can cause hyperglycemia. And one of the factor from this is like dawn phenomena, which is a natural response of the body. Smoking and dehydration are also few factors. And sugar, the hypoglycemia can also happen. Missing meals and excessive medication, or some people who indulge a lot in exercise, they can have hypoglycemia. So these are the things which can actually fluctuate blood glucose levels. So the important, why do we need to check blood glucose, and what is the importance of it? So to adjust the treatment and like to avoid any kind of emergencies, and to have assess like have to have a better control, we need to have blood glucose monitoring management. So to prevent hypoglycemias, and during exercise, we need to check sugars, before and after that, so to have better control. And in case of any infection, so that healing and recovery is not delayed, we need to check sugars during hospitalization. If there are any procedures, so pre and post procedures, the glycemic range has to be monitored so that it is in the target range. And yeah, so to prevent any complications as well. So there are different types of blood glucose monitoring, and that includes like capillary blood glucose test, which is generally through the glucometer; venous blood test, which is generally happens in the lab; and CGM is through the interstitial fluid, which monitors the glucose levels. And measurement of glucose in urine, it assesses through the urine, which is not very much common. So the most common capillary blood glucose test, which a person can do by their self at the convenience of their home itself. So the blood glucose monitoring system measures glucose within the capillary blood. And SMBG is an essential component of modern diabetes treatment, because it empowers the patient and helps them to make informed decision. And yeah, so they can monitor their sugar level to assess the glucose range throughout the day. So they like the fasting, pre-prandial, post-prandial, depending on the therapy, it can be monitored. And yeah, so it is done to detect the glycemic excursion, obviously. So and it also helps recognize and contribute in monitoring resolution of hypoglycemia, so that user can have immediate immediate feedback about the effect of food choices and if activity and medication on glycemic control. So the importance of SMBG is obviously empowering and having informed decisions. and to improve blood sugar control, hypoglycemia detection and prevention. So because hypoglycemia is anyway very critical, so yeah, to prevent, if we are regularly monitoring blood glucose levels, so we are aware of the sugar ranges, and definitely hypos and hypers can be prevented in such cases. And treatment adjustment, I mean, obviously blood sugar monitoring will be helping in adjusting the treatments. So and it also helps us in making personalized, like dietary adjustments and lifestyle modifications considering the patient's current routine. So SMBG is an essential component of the modern diabetes treatment. So, it facilitates patients and healthcare providers to adjust their therapeutic regimes, as we just discussed, and it also helps patient who are taking insulin to adjust their insulin doses, like to have that self titration intervention based on structured SMBG are associated with significant reduction in HbA1c. Obviously, when the sugar levels are well controlled throughout the time, so HbA1c will be better controlled. And yeah, so there are some studies that were conducted in patients with type 2 diabetes on insulin across cohorts of regular SMBG users versus SMBG non-users who have demonstrated, that have demonstrated that HbA1c levels in regular SMBG users were lower. So yeah, by 1%, 0.7 to 1%. Here are general recommendations from SSGI, RSSDI, so which recommends target level should be adequately explained to the patient and provider and mutually agreed between the patient and provider and the clinician. So SMBG technique should be properly explained to the patient, like how many times they need to check, and like what ranges they should be having, and yeah. So and the device should comply with the ISO. Like this is the standard requirement for the device. So yeah, so the recommended target levels for most diabetes patient for fasting sugar, postprandial, and HbA1c are like this 111 mg per DL, 160 mg, and HbA1c 7%. Patients should be educated that that the postprandial blood glucose levels should be checked after 1 to 2 hours from the starting of the meal. Usually, what patients think that once they finish the meal, like whatever time it is taking, they have to start counting 2 hours from that particular time. But it is important that they have to check it from the first bite of the meal, so that we can get a reliable value. And patient may be allowed to take minor adjustment to the insulin doses and changes in the diet based on the SMBG readings. And so here are the study which which help determine the efficacy and frequency of self monitoring of blood glucose in non-insulin treated patients, type 2 diabetes patients. It was a systematic review and a meta-analysis. The objective was to evaluate the efficacy of self monitoring blood glucose in controlling blood glucose levels in non-insulin treated type 2 diabetes patients, to determine the optimal frequency of SMBG and to identify the most appropriate population to benefit from SMBG. So the eligible publications from January 2000 to April 2020 were retrieved from PubMed, and they included random control trials comparing SMBG with no SMBG or structured SMBG. So meta-analysis and sub-analysis were performed to assess efficacy and optimal frequency and the most appropriate population for SMBG. So risk of bias was assessed regarding and randomization, allocation sequence concealment, binding incomplete outcome data, and other biases. So these are the results and key point that 22 studies involving 6,200 participants were identified. SMBG reduced HbA1c by 0.3% compared to with no SMBG, and structured SMBG performed better than regular SMBG with an additional 0.23 reduction in HbA1c. So HbA1c was better controlled with SMBG, which was frequently done compared with other frequencies. And like lifestyle adjustment based on the SMBG results led to greater HbA1c reduction, and SMBG also improved secondary outcomes such as BMI, weight, fasting. Obviously, when sugars would be controlled, so if a patient has like type 2 diabetes and they are obese, so they would be able to reduce weight in a healthy way, and they will be having fasting glucose like in the range and have better waist circumference. So patient education on how to handle high readings and hypoglycemia and how to adjust diet and exercise is important in responding to SMBG. This study also confirmed that SMBG had a limited effect in reducing HbA1c. So until lifestyle adjustments are done with the help of glucose monitoring, there are less evidence that HbA1c can be improved without lifestyle adjustment. So lifestyle adjustments plays a key role here. Self monitoring of blood glucose as an integral part of management of people with diabetes, like type 2 diabetes mellitus. This is the another study. It has discussed the role of importance of self-monitoring blood glucose in the management of type 2 diabetes, and it covered technological advancement in SMBG system, also addressed challenges faced in different countries. So the study design commentarily, or like it had reviewed articles, synthesizes information from various sources and includes perspective from experts in China, India, and Brazil. So the key points here are that SMBG can improve glycemic control, reduce hypoglycemia, and enhance quality of life for people with diabetes when it is used in a structured manner. So this paper emphasized the need for improved access to SMBG, better self management education, and empowered people with diabetes to effectively use SMBG data. So, self-monitoring of blood glucose is in association with glycemic control in newly diagnosed non-treated insulin-treated diabetes patient. It was a retrospective cohort study, and it examined the association between SMBG and glycemic control in newly diagnosed non-insulin-treated patients with type 2 diabetes. So it was a retrospective longitudinal study, and it involved like almost 4,900 eligible patients for a medical center in Taiwan. And the data collected was electronic medical records at baseline of 3 to 6 and 9 to 12 months. And here are the key points that early SMBG users showed greater HbA1c reduction compared to non-users with a maximal difference of zero point 0.5 at 3 months. And the association between SMBG and the better glycemic control was observed in both insulin secretagogue and non-insulin secretagogue groups. And higher frequency of SMBG more than 7 times per week was associated with greater HbA1c reduction. And the users had lower mean HbA1c levels at the endpoint and were less frequently prescribed insulin secretagogues compared to non-users. So this study suggested that performing SMBG from the disease onset was positively associated with better glycemic control in newly diagnosed non-insulin treated type 2 diabetes patient, regardless of the type of medicine used. So yesterday yesterday I met a patient, and he has diabetes from past 5 years, and he has never checked his sugars. He has, like, doctor has advised some medications to him, but he never had taken any medicine, thinking that he may have to take it for the lifetime. So he thought that, if I just skip the medicine, and I just skip the sugar, and I'll be having he may have better control. So then I explained him, like, why did you not check your sugars throughout these 5 years? And when I asked him to get his HbA1c done, he said, no, I don't want to visit doctors, because whenever I'm going to visit them, they're just going to give me a list of medicine and then I have to take them for the rest of my life. I said, no, but you need to see that what is your actual HbA1c. And when he checked his HbA1c, it was 13, and he's 35 years old. So then the role of diabetes educator plays it has a very important role to play here, that until they are not aware, we are the one who make them aware. So I told him that, this is the HbA1c, but how we can bring it down. He said, I don't want to take medicine. I said, no, that you have to consult your doctor and you have to start with the medicine. We will be helping you with lifestyle modification and dietary adjustment. But yes, you have to monitor your sugars regularly so that your HbA1c, with the help of all these support, will ultimately get reduced. So he said, will I I mean, will I get reversal of diabetes now? I said, don't think of reversal. We need to firstly improve the sugar levels. So why I discuss this case, because there is no awareness of checking sugars. People think, that if we check and it may come high, so we have to take medicines. But we have to make them understand that it is not about, taking medicines. It is about knowing the current level and how we can improve that. And obviously, if they need medicine for that, then it has to be there to improve the quality of life and to prevent complications. So here are the ADA recommendations. Moving forward, I'll discuss about it on blood glucose monitoring. So ADA guidelines on the importance of blood glucose monitoring. So as I said, monitoring helps in the prevention. Yeah, blood glucose monitoring helps in prevention of hypo and hyperglycemia both. And frequency of check, it completely depends on individual. Like how many times they need to check depends on the therapy and depends on the case to case. I mean, it is individualized. So it is generally recommended before meals, snacks, at bedtime, occasionally postprandial, prior to or during and after physical activity. When the patient is suspecting hypoglycemia or hyperglycemia, after treating hypoglycemia until it is normoglycemic, and prior to or while performing critical tasks such as driving. The patients who are taking insulin or they are taking some active medicines may have a risk of hypoglycemia if they are having long gaps in between their meals. To prevent such cases, we have to monitor sugars before performing such tasks. So typically requires checking glucose level up to 6 to 10 times daily, although individual needs may vary, obviously. And benefits, what benefit it provides. So increased daily frequency of blood glucose monitoring is definitely associated with lower HbA1c levels, and like 0.2% reduction per additional check per day, and fewer acute complications as hyperglycemia and hypoglycemia. So people with diabetes using basal insulin or like oral or non-insulin injectables. So insufficient evidence for routine monitoring. When to prescribe blood glucose monitor and how. Often for those who are not in on intensive insulin therapy. So let's say if a person is only taking metformin and they have uh, fine sugars. I mean, not
Saima, you have just 4 minutes to wind up.
okay. Okay, I'll try winding it up. Thank you. So yeah, so assessing fasting blood glucose monitoring to inform dose adjustment, to achieve a blood glucose target and result in lower HbA1c level, and to non-insulin user. Routine glucose monitoring may provide limited clinical benefit, and it can offer insight into the impact of nutrition, physical activity, and medication on glucose level. And yeah, so structured blood glucose monitoring coupled with treatment adjustment program can help in reducing HbA1c levels significantly. So key consideration here is that blood glucose monitoring alone does not lower blood glucose level. It must be integrated into clinical and self-management treatment plans to be effective. So here is a case scenario: a 42-year-old woman diagnosed with type 2 diabetes 2 years ago, taking oral medication. Initial HbA1c was 7.8, and the patient enrolled in a program that implemented structured blood glucose monitoring. She started testing her blood glucose before breakfast, lunch, dinner, like following a specific plan. So then, after 6 months of following the structured SMBG program, blood sugar readings had shown a steady decline, and HbA1c was retested and showed a significant improvement. The patient report feeling more empowered to manage her diabetes and experiencing fewer blood sugar swings. So here are the advantages and disadvantages of SMBG. It helps patient to detect acute hypoglycemia and hyperglycemia. Uh, Obviously, it causes empowerment and make informed decisions, motivate patients towards a healthy lifestyle. And yeah, it is easy and quick and can be done at the convenience of their home. But the disadvantages can be like lack of knowledge, fear of needles, pain, self-efficacy, and yeah, so measurement errors also due to interfering substances such as ascorbic acid, which can interfere with the lancet, and hematocrit has negative impact of glucose meter accuracy. So hence these regulatory agencies need to enforce stringent guidelines for maintaining the accuracy to ensure patient safety. So just uh, So the summary here is the prevalence of diabetes is rapidly increasing both globally and in India. There is a need to improve access to SMBG, better self-management education and empowerment of people with diabetes to effectively utilize SMBG data. And HbA1c control was better with SMBG, which was done frequently compared with other like lesser frequencies according to the systematic review. And structured SMBG with a guidance from a healthcare professional can significantly improve glycemic control in patients with type 2 diabetes. And SMBG and CGM can be a powerful combination for diabetes management. And accuracy in both CGM and blood glucose monitoring system is crucial, as both technologies play ongoing and a vital role in patient care. But yeah, the technology is different in technology used in both the monitoring system is different, so the range may vary. I mean, the blood glucose monitoring system has the way of testing glucose through the capillary blood, and CGM checks it through the interstitial fluid. So yeah, there may be some variation, but yeah, it has a vital role in patient care. Thank you.